IMEA was the first to author a code of ethics for medical interpreters, leading the way. A significant milestone that has since been the cornerstone for interpreters all over the world. This code, it's far from just being a blueprint. It's much more than a document. It's a compass that guides interpreters in their professional journey, providing direction and standards for exemplary service delivery in the medical field. It's not just a set of rules, but rather a covenant that each interpreter pledges to abide by. It's a testament to their dedication towards their roles as crucial facilitators of communication in a fast-paced healthcare system, where misunderstandings can have serious consequences. It's a beacon to guide interpreters to serve with accountability, responsibility, and trust, three pillars that form the foundation of the profession. Now picture yourself maintaining total confidentiality, not just as a requirement, but as a sacred trust bestowed upon you. Visualize the responsibility of handling sensitive medical information, the commitment required to protect your client's personal details with utmost integrity. You're entrusted with the task of selecting the perfect language and mode of interpretation to best convey your client's messages, because every word matters. Precision, accuracy, and clarity become your mantras. Imagine saying no when the task is beyond your skills. It's about recognizing the limits of your professional competence and having the courage to refuse assignments that are not within your grasp. It's about understanding the risks involved in undertaking tasks that you are not fully trained for, and the potential harm it could cause. Consider the challenge of avoiding assignments where personal relationships could potentially skew impartiality. It's about prioritizing professional integrity over personal biases, ensuring that your judgment remains objective and unaffected by personal connections and emotions. It's about upholding the principle of impartiality to guarantee fair and equal treatment to all clients. No personal opinions, no unqualified interpretations, just pure, unbiased, professional interpretation, free any personal perspectives or prejudices. It's about placing the client's interests above your own, keeping personal feelings at bay to ensure the most accurate interpretation possible. It's about engaging in patient advocacy, explaining cultural differences, and ensuring smooth communication in medical settings. It's about becoming a cultural bridge, facilitating understanding and empathy between patients and healthcare providers. It's about ensuring that cultural nuances are not lost in translation and that everyone involved in the healthcare process understands each other, despite language barriers. It's about the constant thirst for learning, growing with languages, and medical terminology. It's about participating in continuing education programs, staying on top of the latest advancements in the field, and enhancing your skills to provide the best service possible. It's about forging ties with professional organizations, networking with other interpreters, and seeking mutual growth. It's about staying updated with the latest protocols and guidelines, being aware of new developments, and incorporating them into your practice. Imagine never using your position for personal gain, but rather as a means to serve, to bridge gaps, and to facilitate communication. Never exploiting your role for personal advantage, but instead using it as a platform to promote understanding, empathy, and effective communication in the healthcare environment. In essence, it's not just a job, it's a commitment to ethics. It's about aligning your actions with the values that the profession stands for. It's about upholding the principles of honesty, integrity, and confidentiality. It's about embracing the responsibility of facilitating communication in a critical setting, while tirelessly committing to the principles of the Code of Ethics. It's not just a job, it's a commitment to ethics.